Good morning. I'm MMAC President Tim Sheehy, back with our weekly webcast from 11 to 12 on Tuesdays, providing you with actionable insights to navigate the COVID crisis as we move through the next normal. This webcast is powered by Aurora WDC, a Madison-based market and intelligence firm. They help us make faster and smarter decisions. Visit them at aurorawdc.com. And before we begin, here's a quick tip from Mike Maltesta, president of ERC Midwest, providing decontamination and disinfection services. As you prepare to reopen and resume business operations, it's important to have a thoughtful and well-communicated plan in place that helps your employees feel safe and healthy returning to work. ERC Midwest has an exclusive offer, and you can go to ercmidwest.com/MMAC to find out more. Now, today's program is going to come in two segments. In the first half hour, we'll be joined by Eric Borgerding, president of the Wisconsin Hospital Association, and Dr. Mark Kaufman, their chief medical officer. Then joining the discussion for the second half, we have Senate Majority Leader Scott Fitzgerald and Assembly Speaker Robin Voss. And if you're looking for your fix of Dr. Raymond, president of the Medical College of Wisconsin, he's on daily with us at 3:30. So Eric and Dr. Kaufman, thanks again for taking the time to join us in what has to be a crazy time for your members. Eric, you've been running the Wisconsin Hospital Association since 2002. This certainly must be the most challenging environment for your members. You want to comment on that?
Yeah, I think it's probably the most challenging environment for all of our members, including yours, Tim, for a long time, or if not ever. And it has been now. It seems like we've compressed about 3 years worth of challenge into 2 months. And yes, it's and dealing with the pandemic has been a sort of a phased experience, if you will. And I know you appreciate this, leading the organization that you do, because every week that goes by, not only is there new information, new developments, new data, but we're also new sort of things emerge that need to be considered going forward. It's really like peeling back that onion on a weekly basis, and you kind of discover new or other impacts that have to be considered going forward.
Yeah, Eric, we've, as you just laid out here, all of us are talking about metrics, probably metrics for most of us outside of the healthcare world that we've never come across before. What are the most important metrics for hospitals in managing their capacity in this COVID crisis?
Yeah, great question. I think we have a couple slides that I think will illustrate that quite well. And for that, I'm going to turn it over to Dr. Mark Kaufman, WHA's Chief Medical Officer, and then we'll come back to some other information.
Thank you. Dr. Kaufman?
Thanks, Eric, and thank you, Tim. Good morning. So I think it'll help answer that question. We can walk through WHA's COVID-19 situational awareness dashboard, which really has a treasure trove of data to help people understand what is happening across the state. It is real time. The data is refreshed every 24 hours. And if you look on your screen at the top left of the current slide, what we have portrayed is the data for the southeastern HERC region in Wisconsin. There are 6 other regions. The dashboard is interactive, and one can either look at the entire state, which is 133 hospitals, or any individual HERC region, in this case, the 29 hospitals in southeast Wisconsin. If you then look at the middle graphic box of hospital admissions, this is one of the really important data points. What you'll see is the total number of people in the hospital with COVID-19, which is currently 247, but you can also get a sense of change. So in the last day, that is 5 less, and in the last week, that is 32 fewer patients in the hospital with COVID-19. As you move down that particular box, you can also look at ICU patients in terms of patients with COVID-19 and those with tests pending. So that gives you an idea of hospital capacity and sort of who's in the hospital. In terms of total bed capacity, if you look at the middle of the screen and the bottom box, that really is the total bed capacity in terms of what hospitals have and what is available. So just looking at the first line, ICU beds. In Southeast Wisconsin, there are a total of 652 ICU beds, and available are 186 beds, and that is for both COVID and non-COVID patients. The other sort of critical hospital resource that people are appropriately focused on is ventilators. So on the bottom right, again, a capacity sort of graphic. You'll see that the general use capacity for ventilators in Southeast Wisconsin is 513, and currently in use is 198. So there's a lot of capacity for both COVID and non-COVID patients. And then finally, the top right has to do with PPE, personal protective equipment, broken down by category. Similar to hospital admissions, it looks at the number of hospitals in the last 7 days who have, the number of hospitals who have 7 days or less of PPE, and you see a current column, you see a 1-day change column, and a 7-day change column. Unlike some of the other metrics, PPE is a bit nuanced because many hospitals are part of systems. Often those systems have a central supply house or a hospital where most of the PPE is stored. And often they use just-in-time distribution to their member hospitals. So it may be that the normal pattern of distribution or supply at a member hospital is actually less than 7 days. So that's a metric that takes a little bit of interpretation. Eric, before I go to the next slide, do you have any comments on this one?
No, those are just to reinforce. Those are really critical metrics that we look at that we think do a very good job of gauging hospital capacity. And we thought it was important over a month ago now. WHA thought it was important to build this metric, this dashboard of metrics to give a real good sense of sort of what's happening in the healthcare system as it relates to COVID, not just on a cumulative basis, but on a daily basis.
So Eric or Dr. Kaufman, just kind of, can you summarize as you put this really informative dashboard up, go back a month and then look at it today and kind of in an overall rating, where are hospitals? Are things improving? Are they getting to a point where they can manage the capacity? How would you assess that?
Actually, going to the next slide, that's a perfect lead-in, Tim. Thank you. So what we have here are 4 what are called run charts, which chart the data against time. And this is really particularly informative in terms of trends and what's happening, what has happened, and what to expect. And I would point your attention to, and the audience's attention to, the graphs on the left, starting with the top left, which is positive COVID cases per day. And when you look at that chart, especially the bars at the bottom, there's a lot of chatter and variation day to day. So you'll see that there's a 167 above the bar that's third from the far right, which is 3 days ago. And then it drops actually down to 62 yesterday. So there's a lot of up and down. But when you look at the run chart below that, which is really a graph against time of patients hospitalized per day, you'll see that the high point is 350 on, I believe, that's April, that's about April 13th. And then there's a steady slope down to the latest data point, which is yesterday at 247. So there's a lot of talk about sustained trends in 14-day sustained trends in influenza-like illness or the number of cases diagnosed. But the beauty of hospitalizations is that you really get a sense of what's happening with COVID-19. As many people know, our ability to test patients with COVID-19 is very unstable, very dynamic. We've had all sorts of criteria to try and conserve what limited testing we have. So when you try and make decisions based upon the number of new tests, you're really always dealing with a changing denominator. But that doesn't apply to the people who are hospitalized with COVID-19. Whether or not they've been tested previously, if they need to come to the hospital, they're going to come to the hospital. So when I think about what's happening as a clinician, when I think about what's happening, what's a leading indicator, what's a trend that I can really sort of look at that's not impacted by things like the variability in testing, hospitalized per day is really a very good metric from my standpoint. And when you look at that slope, actually, it really is downward over the last 2+ weeks.
So is there, Dr. Kaufman, Eric, is there a good benchmark for the percentage or number of beds that should be available at any given time?
I think one of the most important benchmarks, especially with respect to COVID-19 and also how hospitals operate, is the percentage of ICU beds. And best practice is often quoted in the literature as 70 to 75% of ICU beds being full in terms of running an efficient and effective ICU unit for patients, regardless of COVID-19.
And Tim, I'll just add to that. That's an important point Dr. Kaufman just made, particularly as we look at the various metrics that are being proposed, either with the Badger bounce back or other blueprints to lift shelter in place. I think the ICU metric is one to really be mindful of, because as Mark just said, depending on where if you use ICU capacity as a metric to gauge the stress on the healthcare system, typically hospitals are managing their ICUs to be at high capacity. So you get really careful. I mean, some of our members are managing their ICUs to be at 85 or 90% capacity on a daily basis, and that's just good management. ICUs are very expensive to staff and maintain, so you want to make sure you're doing those at a high capacity and as efficient as possible. So if we're going to use an ICU metric to gauge whether the system is stressed or not, I think it's really important to understand what a typical daily ICU management strategy looks like, because that just daily typical strategy might put Wisconsin in the red on a daily basis.
Yeah, so that's a really good point, because I'll put myself in that category who's been following this, of the uninitiated. And so what you're saying is, from a business practice, if you're running at 70 to 75%, you really aren't concerned at that point. You're concerned when it gets up much higher in terms of being able to handle the COVID flow.
I think that's correct.
The other thing that I would just add is that hospitals routinely, and especially with the advent of COVID-19, have the ability to surge up their ICU capacity. So they can take an intermediate care bed and turn it into an ICU bed. And hospitals do that all the time, have that capability, but especially in the last few months, preparing for what could have been a very large surge of patients, they have really ramped up their plans and their preparation to be able to significantly increase their ICU bed numbers should they need them.
So let me ask you both a question then about the hospital systems. And can data from the HERC regions be used to inform how different regions might time their reopening, or what risks should be considered under kind of a regional approach like that?
I'll take a first shot at that one, Mark. I think the reason that we wanted to regionalize the data is really for that very purpose, Tim, because we know that COVID-19 is not a statewide sort of one size fits all virus, if you will. It, for various reasons, seems to be affecting different parts of the state very differently. And so, yes, our hospitals are looking at this data from a regional perspective as it relates to the HERC that they're located in. They're also looking at their own data, which they're using to populate the data on this dashboard, and using that information to gauge not only what they're phasing back into doing in terms of procedures and services today, but also as a way to always keep an eye on the future as well, because we know that we have to be prepared. What we're seeing today isn't necessarily what we might see tomorrow. And so you got to be prepared, taking wise steps to phase back into doing certain types of procedures today, but also making sure that you're monitoring the data and you have the data to monitor in order to be prepared if there's a spike or if a surge actually does hit, maybe in the fall or at some time down the future. But it's very much a regional picture.
Yeah, so to that point, the top three counties, Milwaukee, Brown, and Dane County, I think account for about 65% of the positive cases. So to your point, Eric, this is a very regionalized view of how COVID is spread across the state.
It is, and what's really interesting too is as you look at the dashboard, while those three counties comprise the bulk of the positive cases, also look at the trends in those counties of hospitalized COVID patients. There's really two important pieces of information. Yes, those areas comprise the largest number, as you would expect, based upon population or other factors, comprise the largest number of positive patients. But if you really want to look at what the impact of those positives has been on the healthcare system in those regions, the best single metric right now is hospitalized COVID patients. And you can see all of that on our dashboard and make those comparisons.
Yeah, really interesting looking at that Brown, Milwaukee, and Kenosha County have the highest percentage per 1,000 of hospitalized patients. So that, again, is very useful and helpful. As we talk about this, are hospitals, are they planning to kind of bring back online their usual array of services? Where do hospitals sit in that assessment?
Yeah, and we can both tag team on this question. So it was actually, if you can advance the slide, that might help make this point a little bit. Yeah. So I think everyone knows this, but I think it's also worth underscoring. It was back in March 18th, which seems like a very long time ago, that the Centers for Medicare and Medicaid Services came out with very strong guidance, urging all sort of hospitals to really scale back on their what they're calling non-essential surgeries and procedures. And there are three reasons for that. First, it was to minimize exposure, particularly to the healthcare workforce. And actually, before I go on, think about the sort of mindset that we were in March 18th compared to where we are today, where there are a lot of unknowns, and there still are a lot of COVID. There are a lot of unknowns and concerns about massive waves hitting Wisconsin and other states. And so CMS came out with that guidance that basically said, pull back hospitals and health systems on these non-essential surgeries and procedures. As time has gone by, CMS has come out now with new guidance that talks about how to phase back into some of these essential procedures. And in fact, Administrator Verma was very appreciative of the steps that hospitals and health systems had taken to pull back on those procedures, again, to minimize infection, to conserve PPE, but also to maximize capacity, right? That thing we've been talking about, surge capacity, ICU capacity, those kinds of things. So here we are today, several weeks later, with a lot better data than we had on March 18th, as we just talked about. And so what we're seeing now across Wisconsin, and to varying degrees, but almost universally to some degree, are hospitals and health systems very cautiously taking steps to phase back into providing some of these essential and necessary services. And they're taking a lot of things into account when they do that. They're looking at their patient mix, what the needs are in their region, what the risks are in their region. Just taking a lot of things into consideration to do this very safely and in a very phased-in way. And as I said, it's happening all across the state to varying degrees.
So it kind of leads me to a next question, and that is, as the hospital systems have dealt with the COVID wave, as that's flattened, and as you just described, they're starting to cautiously bring back other essential services. The COVID wave is not the only wave impacting healthcare institutions. Can you talk about some of the coming repercussions of dealing with COVID?
Sure, and if you could advance to the next slide, there's an illustration of that. Yes, so this is what I was kind of alluding to as the result of delaying, of abiding by the CMS guidance has been to, one, certainly help flatten the curve and keep capacity available to the extent possible, but we're also seeing the need to start to restart some essential or necessary services because we really don't want to see some of these patients or conditions delayed any further in their treatment. And so this is kind of an interesting graphic that we found that illustrates the multiple waves of COVID, if you will. And frankly, only one of those waves is COVID directly related. And that is, trying to manage and deal with a surge and thus the post-acute care of COVID patients. The other waves relate to the impact of delaying some of that care, delaying some of those procedures. So we got to be very mindful of that as we go forward. And that's really what's driving. There's financial implications as well, as you've heard about, particularly in southeastern Wisconsin. But it's really making sure that we're taking the necessary steps to safely get back up and running and address some of those health care related situations that have been sort of delayed as a result of these strategies. The other thing I'll mention here, and this is kind of one of those when I said earlier, you're kind of peeling back the onion and realizing new things every day. And this is not just with healthcare. This is going to be with all businesses to a degree. The public needs to feel safe and assured coming back to restaurants, coming back to bars, and of course, coming back to healthcare. So this is a dynamic that we are increasingly mindful of. People are reluctant to even maybe come into an emergency room or an urgent care center because of maybe the shelter-in-place order or perceptions about sort of the safety of a care setting. But that's another part of the consequence of COVID that we have to get our arms around and get ahead of, because hospitals are some of the safest, hospitals and clinics are some of the safest places you can go in terms of managing infection and being sanitized and sterile. And if people are experiencing urgent situations or feel like they should not at all feel like they can't come into an ED or an urgent care center. We want to make sure that that word gets out.
Yeah. Dr. Kaufman, maybe a couple related questions here. How accurately do you think hospitals and public health agencies are in counting COVID deaths, possibly for either undercounting or overcounting? And then a second related question is, what do we know about COVID-19 deaths and their correlation to underlying health conditions?
So I think if there's any under or overcounting of COVID deaths, it would probably be undercounting. Because, as we know, COVID has a greater impact on patients who are older, who have coexisting comorbidities, other chronic illnesses. So, when people might shelter at home and unexpectedly pass away, it could be from one of those chronic diseases or it could be COVID related. So I think more likely it's the undercounting. And Tim, can you just repeat the second half of that question? Sorry.
Yeah, and so the second question was, and I think you maybe even answered them both, because one was the undercounting, overcounting, and the other was the correlation between underlying conditions and health and with COVID.
Yeah, if you look at the actually Wisconsin data on deaths on the DHS website, they actually have bar charts with respect to age and mortality, and not surprisingly, you know, the older you are, the higher likelihood it is you'll be in the hospital, you'll be in the ICU, you'll be on a ventilator, and you might even pass away. So, you know, the older people with multiple comorbidities are especially susceptible.
Yeah, and do you expect kind of a similar impact? Just to Eric's explanation of this graph, is there possible that there's going to be a surge in patients who are affected by putting off going to a hospital for non-COVID related reasons?
I think that's certainly probable. I mean, I've been on clinical forums and webinars where oncologists are talking about expecting to see sicker patients, you know, over the next year because people have delayed. A lot of the delays are appropriate. Healthcare institutions have tried hard to manage that proactively. On the other hand, some patients really do get scared, and even if the healthcare institutions are safe and make the appropriate precautions, some patients still will be scared and delay care. And I've seen reports of that actually in the lay press, where doctors have talked to patients, the patients have refused to come in, and they've passed away at home. So I think that is likely.
Eric, let me kind of ask you two questions as we kind of wrap up the first half hour here. And I know that you're going to stick around. Looking forward, what are the biggest challenges for hospitals? And then what are you most optimistic about?
Yeah, well, I think the biggest challenges are kind of what I just talked about. Some of the biggest challenges, and that is getting back to some semblance of normal in our healthcare delivery system. And I think all industries are going to grapple with normal, and what does that even mean or look like now going forward, and the public being assured or confident that they can go back into settings, you know, restaurants, bars, workplaces, that they can go back into settings and that they'll be safe, and the proper precautions will be taken. So I think healthcare will be grappling with those same kinds of dynamics and concerns, and going forward. So that'll be something that we're trying to get our arms around and get ahead of. Some of the positives I think that are going to come out of this are that we're already seeing, as a result of the response to COVID, we're already seeing some sort of care models changing, and the types of the way care is delivered changing in what was meant to be essentially a temporary way, really sort of taking a position that can become more permanent. For example, telehealth. We've been pushing to make telehealth more available from a regulatory perspective for some time. And now, in the sort of as we're using all strategies to still take care of patients, particularly in remote ways, some of those temporary loosening of regulatory constraints around telehealth, I think are essentially being demonstrated right now that those should probably become permanent. Some of those regulatory things that we've relaxed. And I think that's one of the ways healthcare is probably going to change in a permanent way going forward.
Eric, thank you very much for the update on the status of hospitals across the state and a focus on southeastern Wisconsin. Appreciate your leadership of the Wisconsin Hospital Association. Thank you very much for joining us and giving us a really good overview of the metrics to help explain what's happening to COVID from a healthcare setting. And I see now that we're joined both by Majority Leader Fitzgerald and Speaker Voss. I want to thank you both for taking the time to join us and engage in a dialogue on this topic that seems to absorb us all 24/7. So maybe Senator Fitzgerald, I'll start with you in terms of kind of what you hear as top concerns from your constituents and your caucus.
Thank you very much for hosting us today and pulling this together. Obviously, this is a situation that is evolving, if not day by day, hour by hour sometimes. So I've never had to navigate anything this difficult. And I've been through a lot, including Act 10. So this is a certain series of challenges that certainly none of us anticipated. Yeah, I think, you know, when you talk to the caucus and we're back on, we've been caucusing about every other day. So I'm getting a good, I think, feeling for kind of what's going on statewide, obviously, with the makeup of the Senate seats that are included in our caucus. And it certainly is a mixed bag. You know, if you're in southeastern Wisconsin, local news is kind of giving a steady diet of what's happening not only within the city, but in the surrounding communities. And there's definitely a higher awareness and sensitivity, I guess I would describe, to the COVID cases, the numbers, and specifically the deaths that are happening and are linked directly to Milwaukee County. So along with that, there's much more discussion about the amount of tracing that seems to be ramped up right now, testing, and other concerns that are specific to the high density, which is Milwaukee and Milwaukee County. When you get on into the rural areas and you speak to some of those legislators, it does change dramatically, where you know, the best way it's been described, I think, is kind of the snowstorm that never came, in which, you know, we had anticipated and waited, just like the rest of the nation, to see how significant and how acute this would become. And it hasn't materialized, thank God, up until now. So, you know, I know you just had your discussion with Eric Borgerding, WHA, which are at the forefront of this thing and have been for some time. And obviously in many of the rural parts of the state and in smaller communities, the hospital is the anchor that makes up those communities. And they're very concerned on that front. What we have done as a legislature, and I know Speaker Voss is following me so he can fill in some of the holes, but, you know, we early on have been looking at two sets of statutes that have been driving kind of the actions of the governor. Certainly what we see under emergency declarations is a nimbleness that's been granted to the executive branch for a 60-day period, in which it would be very difficult for a legislative body to kind of react and make decisions on a day-to-day basis. So I think that set of statutes that allows the governor to do that is more than warranted. And then a separate set of statutes, though, which quite honestly, because some of these things have not been visited in many, many years, I was surprised to find out, I think, with many other legislators, that it did allow the secretary to make some kind of unilateral decisions specific to schools and churches and other events in which there were many people attending. But the question now that we've been asking the Supreme Court to weigh in on is just how much leeway should be given to the secretary, granted by the governor, and then does the emergency declaration play into this at all? So for us, it's become very black and white. We're asking the courts to kind of give us guidance on exactly how far and how long and what's the breadth of what's been granted to the secretary in making these decisions. And at what point should the legislature, the branch of government closest to the people, when should we be consulted? We feel, and some of this is kind of looking back, and I'm not going to pretend that hindsight isn't 2020 here, but we feel that there should be an ongoing discussion, because what the secretary has been rolling out is basically a set of rules that have the same power as statute. And as a result of that, the legislature should have been consulted and should continue to be consulted in that process. And that's basically what we're asking the Supreme Court to weigh in on. We're not asking them to make judgments on the individual pieces of the shelter in place that the governor issued or the extension. we're simply asking for a decision to be made on that front so that we can get back to a formal process. Informal is different. You know, I've said this before. I mean, you could be on a million conference calls with the executive branch, but at the end of the day, you're not part of the decision-making process. So we're back to a formal, very stringent back and forth with the administration is what we're hoping for, to be able to have a discussion on some of these decisions that are being made.
So Speaker Voss, I'll let you kind of comment on what you hope the outcome from the suit will be, but I want to start with something or a question I don't think most people are aware of. In addition to leading the assembly, you also run 3 small businesses. So I'm kind of interested in your perspective from a small business owner and how you react to what's happening in Wisconsin and the crisis.
Well, thanks for having us, Tim, and I do appreciate all the work MMAC has been doing to make sure that business community understands what's going on, because as Senator Fitzgerald said, it does literally change by the day. You think you have an answer in the morning and it changes by the afternoon. Let me just take a minute and comment on where I think things are and the reality that people are going through. So as Tim mentioned, I have a small business. I have about 60 employees. We have 3 locations in the same city. So we have put all the same things into effect that I think everybody else did. As soon as Governor Evers ordered the stay at home, I think the vast majority of people across the state listened because it was the right thing to do. I think we wanted to be careful. Like many people on the call, we have been doing regular checks with our employees. If anybody has any symptoms, we are paying them to quarantine even before the federal government required us to do so. So I think business people, by and large, are the ones who look at their employees like family in many ways. So you want to make sure they're safe, that they're taken care of. But ultimately, we still have a product to make and a job to do, and we've still got to pay the bills. So I think finding that middle ground has been challenging for business owners, because you have employees who are really fearful, and you have others who think it's completely the opposite, where they're not worried about it whatsoever. So it's our job to worry for them, but also to reassure people that they're going to be okay at work. I think, like many of you, I have had problems just getting supplies, period. I don't know if anybody has those handheld temperature things. If they had a stock of those, they'd already be a millionaire, because everybody that I know is trying to find them and get them. PPE for people who are not in medical care is very challenging. We're in the food business, so we need gloves and all the things that would happen. It is really hard. So the impact of COVID, of course, is primarily on those who are sick in the healthcare system, but the impact is really beginning to spread out amongst everybody else who owns, runs, works in a business, and trying to make sure we can stay ahead of that curve. So legislators are in a special place right now because there is no right answer. It is all a judgment call. I think we took flack from our own party for the first couple of weeks because Senator Fitzgerald and I really tried to give a lot of leeway to Governor Evers, knowing, look, he's got a tough job to do. He's trying to make the best decisions that he can. It is not easy. Then we've kind of gone through the process where, as I look at my colleagues in other states, they have just been much more involved in the decision-making process, not making the decision per se, but offering a different perspective and trying to, have, I don't know how many of you have read the book Team of Rivals, but President Lincoln, after he won the election, brought in his opponents to actually be a war cabinet because they said it shouldn't matter about party. We have one common enemy, and that's keeping the country together. Governor Evers chose a different route. Some governors have chosen that Team of Rivals approach. Actually in Massachusetts, because I'm involved in our national state legislator group, they have a Republican governor and a supermajority in the legislature of Democrats. And they meet in person twice a week inside the Capitol, rotating among their offices, because no one person should make all the decisions and everybody should have the same information, ultimately with the governor making the final call. And I think that's where I wish we could get closer to, because some have, trust me, as I am making my constituent calls, almost everybody is fearful and angry. People on the business side primarily are more fearful and angry of what the economy is going to look like, how their business is going to survive, what's our reopening plan. People who perhaps are retired or already have their income guaranteed in some other way are angry because we're not doing enough to keep everything closed and forcing people to stay home and giving them tickets if they leave their house. So trust me, as an elected official, as Senator Fitzgerald said, this is probably the most challenging time that I can ever remember, because one story yesterday, or last week, I had a guy on the phone who was literally bawling to me, a grown man, because he had his parents mortgage their home in order to get him the money for a down payment on a restaurant, and he's going to lose everything. He had already gotten the PPP loan, and he just needs to know how to plan. And I feel like part of our job is part-time counselor, part-time psychologist. But I will say for all the people who, because they saw something on Facebook, feel like they have an epidemiology degree, it is not real just because you saw it on Facebook all the time. So I think that's our challenge too, because everybody has access to information that they think they are sure is right. And I think all of us realize that there's a lot of information out there, a lot of it good. And the Hospital Association, I want to give them a big shout out. They have done a great job of providing information to the public, making sure it's by region. And that's some of the things that I hope as we move into the next phase, whenever it begins, that we have the opportunity to talk about what a reasonable, gradual, safe reopening plan would look like, so that we can see in other parts of the country where they haven't even had an order, in other places where they've been stricter. There's no one size fits all, but we certainly can learn from the best ideas of everybody and try to bring more people into the discussion, as opposed to make the decisions that seem like they're not always based in rational decision making, and it seems that they're more gut reaction.
So if you and Senator Fitzgerald were appropriately socially distanced from the governor, sitting around a table, and you're looking out ahead between today and May 26th, which is the date that Safer at Home is set till, and the governor now seems to be turning the dial a little bit, what advice and what input would you be giving the governor in terms of how you would like to see Wisconsin policy proceed over the next week or two?
Well, first of all, I'm glad that Governor Evers is starting to do some things that I think most people in the public support, letting people go to parks, allowing businesses to try to find a way to operate. And I think for anybody who's watching and has friends, that are mostly shut down, the ability to do takeout, that's not a profit center. That barely pays your overhead costs of keeping your employees on staff. So I think that's nice that we are able to do it, but we've got to figure out a way that we can take the next couple of weeks and begin that phased-in approach. I think that under President Trump's guidelines, which Governor Evers said he is closely following, they really envisioned a much more regional approach. As the Hospital Association said, you have these HERC regions where you can see parts of Wisconsin where they have had few or very few outbreaks, especially over the course of the past 7 to 14 days. So treating everybody in the state of Wisconsin the exact same seems to me to be an area where we could work together on. We think that there are parts of Wisconsin that could have a more gradual opening, other parts that might have to stay a little more closed because of the challenges with the communities that are in those areas. But I think the WMC, MMAC ideas of trying to have, a system for businesses to know they're safe, for customers to know they're safe, for WHA and our partners to all work together, that's where we should start from. And it seems like however Governor Evers is making these decisions, it's like it's in a magic box where nobody necessarily understands what the metrics are, how do we hit goalposts, what are the things that actually have to happen. So that would be my advice, to sit down and work with us to say, look, we're all in this together. There's no us and them. There's no challenges that we can't overcome together, but to do it more transparently and to give answers that are a little bit more understandable for the man, woman, business owner trying to figure out how to save their company.
Senator Fitzgerald?
Yeah, I think the biggest item that has to be addressed, which they are completely dug in on, is that they will not take a regional approach to this at this point. And I think the sooner that changes, the better off we all will be. Minocqua is not Milwaukee, and those parts of the state that are not experiencing the same level of cases as well as deaths should be opened, and should be opened quicker, because that is ultimately what will support Milwaukee and southeastern Wisconsin, is have the rest of the state open up. And this would be at a different level, then you could probably even have a discussion with the constituent about, but they have to know, DOA has to know, the budget office has to know that we are on the brink of having a budget that's going to completely flip on us from where we were 6 weeks ago. Just yesterday, I heard some numbers on DOT where gas tax collections are half what they typically would be. When you think about K-12 education, you talk about the safety net with health services. All of these things are very vulnerable right now because the state budget is, and the revenue streams associated with it are dwindling. That should be a great concern to the governor of the state of Wisconsin. And the quicker we can turn, the better off we'll be. Now, I get that's not popular, and that there's many health concerns that I think need to be taken into account, and should be continue to be monitored and developed. But I think to just absolutely refuse to take a look at the regional calculation is a mistake, and that is something that I hope they at least start to consider moving forward in the next couple of weeks here.
So again, the summary, your advice would be kind of in a safe way, moving that dial faster, and then looking at some of the regional nuances of the COVID cases and the spread, and starting to do that at a different rate. Is that a sense of where you're both kind of pointing?
Yeah,
I mean, I
would
am. Yeah, I was just going to say, I mean, I am. I understand that there are a lot of Wisconsinites that are very scared. And even though you see different kind of approaches at the retail level, and it's kind of a mixed bag as to how the private sector is operating right now. And quite honestly, it can be very confusing. Just this morning, the governor reopened the state parks after closing them last week. I mean, I think there's some real issues related to what the average citizen is hearing out there. But no, I think, the quicker we can move in a safe fashion, obviously, is what everybody wants. And I think we can see that now. We can see kind of how this thing is shaking out. No one knew where we were 6 weeks ago, and anybody who says they knew exactly how this was going to play out is lying. But as we sit here today, I think we have a better temperature on exactly kind of how we can proceed. Now it's a matter of trying to execute that.
The only thing I would add to what Senator Fitzgerald said, because he's right on target, is that there are certain metrics that I think all of us have to accept are going to become part of whatever reopening plan we have. We have to have more testing. There's no doubt in my mind that the governor has been working on that. It hasn't happened as quickly as some of us would have liked, but he's trying, and I think that's exactly what we need. I think we need to also do contact tracing, especially in the city of Milwaukee and places where are these hotspots. Now, I know in my own community, they have their own, in Racine County, they have their own team ready to go. And it sounds like they are not always being utilized because the governor is looking to hire his own people, and I get that. But it seems like more coordination, more ability for us to use the resources that are on the ground instead of reinventing the wheel, trying to make sure that, especially on testing, that we figure out how we ramp that up in a way that it makes sense. Because if we're only testing people who are coming to the hospital or some of those things, we're going to continue to get high case counts, and that in many ways isn't necessarily reflective of where all of society is. So I think we have to get all those things in place. And frankly, that's an area where, again, I think if Governor Evers would, I think Governor Evers, by and large, again, has tried to do a good job to display that he's confident, that he wants to have the things that are good for our state. But I think that the more that we could work together, the stronger the public would look and say, okay, state government has its act together. It's not partisan. People want to all work together. I know Senator Fitzgerald and I sent a letter last week asking to sit down and begin to negotiate and say, okay, how could we work together on this? We have not yet heard back. So, if any of you have influence with Governor Evers, I hope you would encourage him to say, hey, sit down with people. Let's talk about it together, business community, legislature, because, when our state was, founded, the whole idea was more ideas and more minds make better policy choices. And for whatever reason, that seems to not be happening, and hopefully it will going forward.
So, one of the challenging things is, and I know both of you have talked about this, is a lot of state policy when it comes to COVID is kind of a blunt instrument. It's hard to, direct it. And so when we talk about the concept of a dial kind of loosening up the state, how do you look at it in terms of kind of also being able to come back if there's a challenge? So one of the questions that we had is that, Wisconsin is a very mobile state from the perspective of, people having other places to go, and in northern Wisconsin, getting visitors from Illinois. So as we kind of look at this regional approach, if people are going up for fishing season, if they're going up to Minocqua or Door County, how do we kind of construct a way in which Wisconsin's going to be dealing with, especially in the summer months, large numbers of people moving across regions, either to recreate or, in the case of some of our regional communities here, living in a low a county with a low incidence, but going to work in a county with a high incidence?
Well, frankly, that's one of the challenges we have to figure out if we want our economies to really thrive. I am really worried about our tourism industry. It is the lifeblood of a lot of communities across the state. We already know big conventions that could potentially come to Milwaukee, like the DNC, the Ryder Cup, are still tentatively on. Let's hope that they stay that way. But I think no matter where you are in Wisconsin, people are going to have to use best practices, right? I mean, if you are someone who is in a risk category, you might think twice about this season going up north. But if you're somebody who is not in a risk category, you still should be safe. So when you go up north, you figure a way to socially distance where appropriate, enjoy all the great things that there are. But I think that we're probably going to have a lower number of folks going to places around the state anyways, just because of the worry about the virus. So I think some of that's going to naturally happen. But again, if you keep things locked down too tight and you don't have a reasonable, rational plan, I think people are going to kind of choose to do what they want to, and then we're going to have issues. So that's why I think, as I said today, I think it was good that Governor Evers released some pressure out of the system to be able to have these parks get open, but that's got to keep happening. And my hope is that we could put it in a plan where we work together and say this is something everybody buys into, as opposed to just kind of having random announcements, any day of the week.
Senator Fitzgerald, you brought this up, and let me ask you both to draw on your extensive experience in the legislature, putting together budgets, taking apart budgets, and you touched on this. As you look ahead, how do you assess the financial impact on Wisconsin from the lost revenue from an economy that has been largely bottled up, not just because of safer at home, but because of other economic pressures? And we had, I think, at one point, or maybe we still do, the largest rainy day fund. But as we start to put the budget together, as both of you know better than I do, Wisconsin has a constitutional requirement to balance the budget. So what does that look like as we come into 2021?
Well, I guess I would start with, you saw what the U.S. Senate did last week, and that was to negotiate the latest relief package, but it did not include any dollars for state and local government. And actually, Senator McConnell was very clear that he did not want to add anything in there that might help to bail out states like Illinois that have massive pension debt. So there's a little bit of political back and forth going on there. And maybe it appears that this morning there was a little bit of light on that front. But other than that, I mean, yeah, it's going to be really difficult, I think, to develop a strategy that won't include Governor Evers increasing taxes. Let's be quite honest. I mean, that's going to be his fail-safe is going to be say, let's just increase taxes on whatever he may choose. But as long as there's Republican control of the legislature, that is a high hurdle to try and get a legislative body to go along with that. So you find yourself in somewhat of a stalemate. And then it, because of the way the state budget operates here, it just continues forward with current levels. Well, that's going to be a tough thing moving forward, and it's going to be really rough on shared revenue, on K-12 education, on health and human services, all of these things. It's going to be very difficult, I think, to build consensus around anything. So it's not a pretty picture right now, and I think it will be impacted on whether or not the feds do something.
The only thing I would add is that we actually requested Governor Evers to consider freezing the second year of the budget. So Wisconsin has a 2-year budget. First year, we're in the middle of it. That ends on June 30th, and we start the second year, go through the election, and then come back probably in January to do some sort of budget repair when my friend Scott Fitzgerald is a member of Congress, so he won't get to have the fun of doing that. But this is one of those things where we have the opportunity to make some decisions right now that would mean less pain later. I don't think anybody would say that freezing spending in a time when basically revenues are cut through the middle of every single program would be a bad idea, but we haven't been able to reach consensus on that either. So automatic increases are scheduled to take effect July 1st, which will mean, unfortunately, if the money is not there, we will have to do some sort of budget repair bill after the election. And I just think it'd be a lot smarter for us as any business would, you cut expenses as soon as you see a revenue decline. You don't wait until you confirm that the revenue decline is there 3 or 4 months later, and then have to make much deeper cuts than would have been necessary had you thought a little bit ahead.
You know, it seems one of the challenges that we're all facing, and the governor in his Badger Bounce Back plan put in these gating metrics. And the challenge I think we have is assessing those metrics the same way. So I'm interested in kind of your reaction to kind of the gating metrics. And it seems whatever metrics we're discussing, there's still a subjective judgment as to when those metrics are at a certain level to start to dial up and open the economy. Kind of what are your thoughts are on building consensus or how we assess those metrics going forward?
I guess the way I look at it, I appreciate the fact that it's not as simple, and that's a good analogy, right? It's not flipping a switch, it's turning a dial. I think that's an excellent analogy. But it also means that sometimes you're going to have to turn the dial and make an adjustment. I understand that. But I feel like a lot of the metrics that have been put out there, it's really more like trying to, figure out where the dial is sometimes, as opposed to turning the dial. So I support more testing. I agree with that. I think that's a good idea. I think that having a downward trajectory has really not been explained what that means. Hopefully we'll get more clarity on that so we can understand what that means. Having PPE, we see on the Hospital Association website, they are making progress on that almost every single day, to their credit and the credit of the Trump administration and the governor for bringing more and more of those things in. I think the WMC MMAC idea of trying to have a way to classify different businesses in a community with different risks. Obviously, a single standalone person is nowhere near as much of a risk as a large business with many more customers coming and going and many more employees, deliveries, et cetera. So having them treated the same, that seems to be a bit arbitrary. So hopefully in his bounce back plan that we could negotiate with him, some of those things would be taken into account. So you put metrics in that realize that not every business is the same, just like not every person or every agency should be treated the same.
So here's a
let me just add real quickly. Yeah, let me just add real quickly. Here's one of the issues that exists, and this has been confirmed in my discussions, not only with physicians from the district, but with some of the hospitals currently that are doing testing. There's 2 types of testing. Those that are actually looking for whether or not an individual has antibodies that have already been built up. It has to be done in a very controlled clinical setting and is not necessarily very accurate at all. And the second is obviously the one we're much more familiar with and that we're seeing all the time, where they're swabbing to see if there's an active virus. So that's the first thing that has to be cleared up, is what type of testing and what type of cases and positive responses. Because the other issue that a lot of physicians are running into is people are showing up with the symptoms. They are completely convinced that this person has COVID, and yet they can't get a positive test. So for Governor Evers to set kind of this hurdle that needs to be overcome, and we're not sure today if we're in day 2 or day 12 of what he's required at this point, the problem's going to be that you have to build consensus over exactly how those readings should be interpreted. And I don't think we're there, and I certainly don't think we're going to be able to arrive at a consensus by May 23rd. So, this is not only happening in Wisconsin, but it's happening in other states where, now you've got states like Georgia that have already blown it wide open and are not necessarily, they're talking a good game when it comes to testing, but they have no criteria in place. And then you have Wisconsin, which has, probably the longest date out there. And it's going to be very difficult to meet any of those standards, let alone try and do that by May 23rd. Let me just say one other thing about contact tracing. Obviously a discipline that's been part of the medical community for many, many, many years, but none of it is ramped up. I mean, literally most health departments, if they had anyone on board that was actually monitoring and trying to develop a strategy there, they are now just hiring more individuals and bringing them on board to try and do a better job at tracing. So the idea that, whether it was early April or mid-March, whenever it was, we're just not up to speed. And I don't think that that's going to change between now and May 23rd.
So maybe one kind of, I got 2 last questions, but one is a question from one of our audience members. If there's a phased approach to reopening, should there also be regional plans for restrictions in the event of an outbreak in a particular region, since we live in such an interconnected world? So if the state's going to kind of dial back and open up regionally, would you support kind of regional plans that allow them to act locally?
I definitely would. And I think if you look at the artificial borders we have between states, that's kind of already what's happening, where Illinois, Iowa, Minnesota, Michigan each have their own plans, and people travel back and forth from Illinois to Wisconsin to work, just like they do to the other states. So having the ability to, again, have a plan, adjust the plan, but make sure that people clearly understand what occurs and what happens, I think is the easiest way to do it. So having a regional approach, to me, means that if for some reason there's an outbreak in Eau Claire, they're going to have to adjust how they deal with the people who are coming and going to Eau Claire and the people who move around in that region. But to treat us all the same when the number of people who go from Milwaukee to Eau Claire on a daily basis is pretty limited, seems to me to also be too far reaching. So there's got to be a common sense consensus that we can do that makes what you had said happen, but also allows us to have some common sense opening.
Okay, a quick closing for both of you. What are you most optimistic about? And then we'll finish with those answers.
Oh, the thing that I am most optimistic is that we're starting to get a handle on the profile of what we're up against. 70% of those that have been directly affected and find themselves in a health crisis are age 70 years or older. That's significant. The other thing that we're seeing is hotspots as they emerge can be traced back to literally the logistics or the setup. So whether it's a meatpacking plant, unfortunately, with very close contact, we know that those are going to be hotspots that have to be monitored moving forward, and probably industries that have to modify the way they do business. And then the other thing would be, we're starting to see that at the end of the day, I think schools are going to be a place in which we can really rely ultimately on that being kind of a basis of stability for us, because it is not having a direct effect on young children. That that's part of the social network that props up everything, and it's going to be really hard to get people back to work if they have to stay home with their children for a long period of time. So I mean, that's the bright spot. Is I think we're starting to get a handle on this and understand some things that we didn't understand even 6 weeks ago.
Ross?
Thanks, Tim, and thanks again for doing this today. I really enjoyed it, and I appreciate the fact that you're kind of keeping in touch with your members. And that's one of the things that I guess I am most optimistic about, is that, my first job in my life was actually as a stock boy in a small grocery store. Never in my life did I think that I would be called an essential worker because of the job that I did stocking shelves. So I think we have a newfound respect for every single person, no matter what their career choice is, what they do for a living, that every job is essential in one way or another, and we're proving that as we go forward. So I'm really optimistic that business owners are finding a way to get through this, and trust me, it is challenging. I feel, like I say, in my heart, I grieve for these people as they are dealing with the loss of employees who are on extended unemployment and probably don't want to come back. As you are dealing with how's my business going to open? How am I going to make these things happen? But I think the business community is so much more resilient than I ever even realized. I hear a lot of people already planning for when the reopening is. They are like, ready for the cannon to fire so they can begin to get things back to semi-normal. And I think that's just the resiliency of Wisconsin. So yeah, it's been a hard time. It's been incredibly tough. I feel bad for every family who has lost somebody. That is a tragedy. But I also know that we're going to turn the corner. We're going to be able to move forward. And hopefully in the next couple of weeks, we'll keep turning that dial a notch at a time. And before you know it, we'll be back to closer to normal, probably a few years before we're back to like we were before. But hopefully every month that goes by, it'll be closer and closer to the way we used to love to have our state be. Thanks again for having us, Tim.
Yeah, Speaker Voss, Majority Leader Fitzgerald, thank you very much for the time. Thank you for your commitment to Wisconsin, and thank you for your leadership. Have a good afternoon, everyone. And we'll see you next Tuesday if you're watching the 11 o'clock broadcast, and we'll see you at 3:30 this afternoon with Dr. Raymond. Have a good afternoon.
Thank you.
Thank you.